The InSight Scleral lens by Metro Optics can be used on virtually anyone. It works equally as well on normal, spherical, and astigmatic corneas as it does on compromised corneas with irregular astigmatism, keratoconus, post-surgery, and trauma. The InSight Scleral lens can also deliver multifocal correction up to 3 diopters of add power. Give your patients with either normal or compromised corneas excellent distance and reading correction in a remarkably comfortable lens. Thank you for joining us for this short tutorial that will outline the easy steps you should take to select and evaluate the first diagnostic InSight Scleral lens for your patient. The InSight Diagnostic fitting set is comprised of both prolate and oblate diagnostic lenses, which are 250 microns thick and are in 250 micron increments between each lens. To choose the first diagnostic lens to be applied and evaluated, begin by determining the corneal profile. Determine whether the patient's cornea is prolate or oblate. For spherical, astigmatic, keratoconic, post-LASIK ectasia, or other high-elevation corneas, begin with the prolate SAG 5.0 lens. Use the oblate series for corneas with low elevations such as PMD or post-surgical patients, including post-PKP, RK, PRK, or LASIK. For these corneas, start with the oblate SAG 4.75 lens and evaluate. To apply the lens, hold it base curve side up and place it on a large suction cup. Overfill the bowl of the lens with preservative-free saline and add fluorescein to the bowl. Have the patient tilt their head down and look at the floor. Gently apply the lens directly to the cornea, making certain the fluid stays in the bowl of the lens. For more details, be sure to check out the video on lens application and removal. Once the lens is in place, evaluate central clearance using the thickness of the InSight lens as reference. Assess the fluorescein pattern using white light and the optic section technique with the slit lamp. If you see central touch, remove the lens. Select the next diagnostic lens, which has 250 more microns in sagittal height, and apply the lens on the eye. If the tear layer thickness is twice the lens thickness or more, remove the lens. Select the diagnostic lens, which has 250 microns less in sagittal height. Reevaluate the lens. Once you find a lens which provides an equal thickness of post-lens tear reservoir to the thickness of the lens, allow the lens to settle on the eye for 20 to 30 minutes. After the InSight lens has settled, begin your final evaluation of the central clearance. Using the thickness of the InSight Scleral lens as a reference point, assess the central clearance of the post-lens tear reservoir. Clearance should be as close to a 1-to-1 relationship, resulting in 250 microns. In other words, the central pooling of the fluorescein should be approximately the same thickness of the lens. An ideal goal is to have fluorescein pooling 3/4 to 1 1/4 times the thickness of the lens. Take a look at the images on the screen. The tear pool is thicker than the lens, indicating a lens with a high central clearance. In the pattern shown here, the tear pool is shallower than the thickness of the lens. Here is the ideal central clearance of 150 to 300 microns, with the tear pool similar in size to the thickness of the lens. Now, move to evaluate the limbal area of the lens. First, use the cobalt filter to evaluate if fluorescein extends 360 degrees into the limbal zone, noting areas of touch. Then, using the lens thickness as a reference, assess the limbal clearance with the optic section technique. Fluorescein pooling should generally be 1/4 of the thickness of the lens. Make sure you look at the entire circumference of the limbal zone and note areas of touch or excess pooling. Also, make sure to swing the beam left to right while doing the evaluation. Let's look at these fluorescein patterns. When the sagittal height at the limbus is too high, the tear pool is greater than 1/4 of the lens thickness. When the sagittal height is too low in the limbal area, the tear pool is barely visible. In order to review fluorescein at all, there needs to be a minimum of 40 to 50 microns. When there is ideal limbal clearance, The tear pool is approximately a quarter of the lens thickness. The final area to evaluate is the edge or haptic landing. The ideal edge should land evenly on the sclera. Check the alignment 360 degrees around the lens edge. Be certain to check under the lids as well. Here we see fluorescein pooling along the edge with bubbles forming on patient blink. You can also see the tears exchanging too quickly under the lens. This would indicate you need a steeper edge. Here we see impingement. Note whether impingement is at the outer lens edge or located within the lens landing. There should be no standoff or blanching of blood vessels in the full circumference of the lens. If there is an uneven fit, it may require a toric periphery. Refer to our short video on evaluation for toric haptics. To determine the final lens power, perform a spherocylinder overrefraction. If the patient is presbyopic, an add power of up to 3 diopters can be ordered. When ordering the lens, specify the required add, as well as the pupil width measurement taken in normal room illumination. Once all your information is gathered, call Metro Optics to order your InSight Scleral lens. It is recommended you talk with consultation on your initial order, as there may be changes which need to be made based on your diagnostic fitting. Thank you for joining us for this short tutorial outlining the easy steps needed to diagnostically fit the first InSight Scleral lens for your patient. Which patient? Any patient.